Hi, I'm Tim Caruso with an ergonomic tip. There's a significant chance of experiencing an episode of back pain at some point in our lives. The prevalence increases and peaks between the ages of 35 and 55. Dental practitioners may be at higher risk because of prolonged sitting, awkward postures, sustained muscular contractions during the course of the working day. Most back pain is a passing thing and can be diminished or eliminated by sitting up straight. You might consider incorporating some of these simple stretches into your daily routine. Dr. Shermer is going to show us some back bends where he's going to place his hands behind his neck. He's going to bring his elbows forward, and he's actually going to look up and lift his elbows towards the ceiling to stretch his upper back, just like so. The next one he's going to do is bring his knees apart and reach down towards the floor to stretch his low back. Nice and easy. Next is putting his hands on his chest, and he's going to rotate towards the right and stretch, and towards the left and stretch. The next one, he's going to place his right hand on his hip, and he's going to reach over his head and side bend towards the right and towards the left. The last one sitting, he's actually going to slouch in his chair, so he's going to flex his back, and then he's going to arch his back and come up into a really nice tall position. And he's going to do that several times. And on the last repetition, he's going to come up as high as he's comfortable and then come down into a nice seated, balanced position. The one standing exercise in the operatory, he'll stand up, he'll place his hands on his bottom with his feet shoulder width apart, and he's actually going to lean back over his hands while he keeps his knees straight. Just like so. You should seek medical attention if the pain has gone from an acute episode to more of a chronic situation or progression of symptoms from your back or your neck into an extremity. A workup by your family doctor may be in order. You may be placed on medication, but an alternative would be to seek out a practitioner trained specifically in the care of neck and back pain. Seeing a qualified therapist is a good place to start. The key is to find what works for you. Here's to a healthy practice.